Okay. Well, we at Bracken County Nursing and Rehab Center offer our patients, and that includes inpatient and outpatient as well, the full spectrum of therapy services. That's going to include physical therapy, occupational therapy, and speech-language pathology. And together we therapists work to design programs that will help rehabilitate our patients back to their prior level, if not better, so that they can safely return home. Okay, so briefly, if I was going to describe the three different therapies, physical therapy focuses on helping residents with their functional mobility skills. And that could be, for an example, bed mobility, being able to position themselves in bed and being able to get in and out of bed. Also the ability to transfer, and that would be going from a sitting to a standing position safely, and also walking. All right. We do this by employing a lot of different exercises, our focus being on increasing strength, joint range of motion as needed, balance and coordination. Okay, occupational therapy works more with the patient and their activities of daily living. That would include bathing, getting oneself dressed, and also preparing simple meals. And again, we do all of this in preparation for the patient to return home. In occupational therapy, because most of our daily living activities involve the hands or the arms, occupational therapists focus on returning function to the upper body or to the arms and hands. Speech therapy looks at the patient and helps them develop communication, meaningful communication skills, as well as working with them on swallowing or feeding problems. Okay, alrighty, and I think one of the first questions that come to mind from my patients are, am I going to be able to participate in therapy? Am I going to be strong enough for what you're going to expect of me? And I want everyone to know that we design individual programs for each one of our patients. For example, if a patient has recently been discharged from a hospital, in all probability they're very weak, and initially may only be able to tolerate 20 to 30-minute treatments at a time. In that instance, we might break up their therapy between morning sessions and afternoon sessions. However, as the patient becomes stronger and their endurance builds, then we can start increasing the treatment times until that person can tolerate one treatment a day, and that usually is between 50 and 75 minutes. It's not uncommon for our new patients to confide in me that they're afraid that they will never be able to make it home. And I try to assure them that by far the majority of our patients are successful with therapy. They complete all their goals, and in fact are usually stronger and more independent than when they first came in. And certainly they'll be able to return home. Well, I think that one of the things that sets Signature apart from perhaps other companies is that Signature is truly committed to the resident and hires our own on-staff therapists. That gives us the opportunity to really get to know each one of our patients and for them to get to know us. And there's continuity of care, which I think overall produces the success that we do enjoy with our therapy department. With contract therapy, very often there's an influx of different therapists, and a patient will become very fond of a therapist and doing well with them, only to have their treatment interrupted with another therapist coming in to fill in. But we at Signature, and especially at Bracken County Nursing and Rehab, we have committed therapists on staff employed by Signature. Speaking for myself, I've been with Bracken County now going on 4 years, and I just love it. Myself, I am a therapist who's been practicing for 22 years. I'm a geriatric specialist. Our occupational therapist is just about as experienced. She has 20 years experience, currently working on her PhD in geriatrics. So, and with our speech therapist together, I think we make a very dynamic team that serves our residents and our patients.